Chapter 4: High Dose Vitamin C, Prime Arterial Protector. Coming unglued, the heart of the problem. Coronary heart disease, atherosclerosis, is a malady that sends millions of Americans to an early grave every year, millions more to emergency rooms, and thousands of patients to a cardiac surgery suite every day at an average cost of over $100,000. Although these facts are alarming, they're not news. Here's some real news. All coronary arterial blockages have a solitary root cause. What is this root cause? Is it excessively high triglycerides or fats in the blood? No. These are only indicators of disease risk, since they play an important role in the worsening of arterial narrowings, but only after the disease has taken hold. What about high serum cholesterol or high blood pressure? No. These two are only factors that worsen rather than initiate blockages. Currently, there are over 20 commonly accepted risk factors for this major killer, but none of them, individually or in combination, initiate coronary heart disease. Coronary heart disease starts when the innermost protective lining, the intima of the coronary arteries, begins to come unglued. This lining is comprised of a single layer of cells that functions like ceramic tiles on a shower wall. And just like the cement and grout that holds the tiles in place, there is a gel-like substance called ground substance in between and under the protective cells that holds them onto the arterial wall. As long as the ground substance remains firm and healthy, these cells stay in place and the artery is protected from disease. When the ground substance becomes watery, however, open spaces between these lining cells appear, allowing plaque-building substances in the blood to enter more easily. The process of plaque formation, and the subsequent clogging of the artery requires this arterial change in the consistency of ground substance from gel-like to watery. Question: what causes the deterioration of the ground substance? Answer: a localized deficiency of vitamin C in the coronary arteries, called a focal scurvy, results in a breakdown of the ground substance. In contrast, a continuous and generous supply of vitamin C to the arterial linings keeps the ground substance in its healthy gel-like state. That means the solitary root cause of all coronary arterial blockages is a vitamin C deficiency in the coronary arteries. Furthermore, vitamin C is required for the formation and maintenance of strong and resilient collagen. Since collagen is one of the main structural components of the arterial wall, a continuing deficiency of vitamin C is responsible for more than initiating arterial disease. The C-deficient environment also results in an unrestrained buildup of plaque as the body attempts to fortify arteries continually weakened by a declining quality and quantity of collagen. For decades, traditional medicine has addressed coronary heart disease by treating symptoms and attempting to limit risk factors without addressing or even acknowledging its root cause, a focal scurvy of the coronary arteries. As a consequence, Americans spend billions of dollars every year on expensive drugs and even more expensive procedures that only retard the progression of this lethal disease. All the while, effective vitamin C supplementation would prevent the disease in many who do not already have it. A thorough review of the scientific evidence indicates that coronary arteries with uninterrupted, abundant access to vitamin C would never develop artery plugging plaques. If all of us maintained a C-rich environment in our coronary arteries, the massively lucrative heart disease industry would dry up overnight. And for those who already have coronary heart disease, there are effective vitamin C protocols that would halt the progression, and in many cases even dissolve the proliferating, life-endangering plaque that clogs their arteries. In a published case study, for example, an angiogram revealed a 75% blockage in the right coronary artery and 50% blockages in other arteries of a 62-year-old female. A treatment combination featuring vitamin C, lysine, and proline was used to treat her for approximately 19 months. At the end of the treatment period, a repeat angiogram revealed that the 75% blockage was reduced to 40%, and the 50% blockages had disappeared altogether. The level of blockage reversal is considered impossible by traditional cardiac medicine. But the case above, as well as studies published over 50 years ago, show that the arterial plaque buildup is irreversible mantra is simply not true. It also shows that the reversal of significant blockages can be a very realistic goal for many heart patients. Understanding the heart disease process. This may seem a bit simplistic, but for the vast majority of coronary heart disease victims, the process starts and progresses as follows. 1. A localized vitamin C deficiency develops in the coronary arteries. 2. Injury to the artery results from a breakdown in the protective lining of the artery as the ground substance becomes watery. The artery then loses its ability to securely affix and seal the interior protective cells on the arterial wall. Plaque begins to form as calcium, cholesterol, fats, and other substances floating in the blood penetrate the arterial wall through the gaps left by the deteriorating ground substance. Sensing an evolving weakness in the artery, the body compensates by trying to patch, seal, and fortify it. The body will even synthesize wads of collagen fibers over the arterial lining in an attempt to strengthen the failing vessel. As all this compensatory activity continues, the arterial walls harden, thicken, and begin to block the flow of blood through the vessel. If the C deficiency is quickly and adequately addressed, the artery will heal and the blockages will shrink. If not, the blockages will continue to grow and eventually endanger the life of the victim. An all-out C deficiency, general scurvy, can certainly produce this disease-causing focal scurvy in the arteries. However, such patients die long before arterial blockages become a problem. Multiple factors that contribute to a vitamin C deficiency include the following. Normal, everyday toxic exposures, ever-present pathogens, even when no infection exists, free radicals from normal metabolism, the many bodily processes that require vitamin C, acute or chronic infections. Humans no longer synthesize their own vitamin C. Additionally, all of the accepted risk factors for coronary heart disease contribute to a vitamin C deficiency and/or are made worse by it. The link between vitamin C and all these risk factors will not be covered here, but a list of them with supporting studies can be reviewed in Resource D. Because cholesterol, high blood pressure, and diabetes are especially high-profile risk factors, they will be given special attention later in this chapter.